questions to our expert. Wow, we're already being lit up with questions. Let's go ahead and take these guys on air, okay? Hi, welcome to Doc Talk. What's your question? Sir, that's actually a good question, but today, if you can go on our website and ask for back pain specifically, today our guests are specialists in foot pain and podiatry. Let's go ahead and take another live caller. Hi, I'm sorry. There you go. Hi, welcome to Doc Talk. What's your question for our expert? Thank you, Abby. Dr. Bhakta?
Sure, yeah. This is Dr. Bhakta again. The ankle swelling that you're describing could be anything from probably overloading sodium or too much salt over the Thanksgiving and turkey, whatever. But it could be anything, different things. So, but I do recommend getting it evaluated if this problem continues for you, because you need basic things such as X-rays, further evaluation, probably lab work to evaluate what may be causing this. But looks like you need to go see somebody if this continues.
All right, let's take another call. Hi, welcome to Doc Talk. Go ahead with your question.
So this is Dr. Mehta again. Just like we were talking before the break about plantar fasciitis, the most common symptom of plantar fasciitis is painful first steps in the morning. So what I recommend is you stretch before you even get out of the bed. Do the frozen ice water bottle roll like Dr. Bhakta mentioned before, and then come see us because we can put you in custom orthotics. Those are made for you, and ranging from like anti-inflammatories to like ultrasound therapy. We have a lot of different things, night splints we can do for you in the office and help you with your pain.
All right, let's take another call. Hi, thanks for calling Doc Talk. Go ahead with your question. Sure, thank you.
Hi, this is Dr. Bhakta again. Yeah, this is an ongoing thing like I mentioned earlier about heel pain, a very common condition. It starts with obviously weight does contribute, so obviously if you get to shed a few pounds, that always helps. But I recommend doing daily stretching exercises, good support, void flats, anti-inflammatories as needed. But if the problem continues, it does help to go see somebody like us.
Okay, before we go back to the phone lines, I know there's people on hold. Please keep waiting, but we took a call off the air during the break that I thought was good. A woman had called in and said she had shin pain when she walks or runs more than usual. Any thoughts?
Sure. So this is Dr. Mehta again. So when somebody has shin splints, I recommend that resting for some amount of time, like reduce your physical activity. They can ice, and then stretching is very important. So the more you stretch your gastrics, that would be better to help with the shin.
What are the gastrics for?
The calf muscles.
Okay, the calf. Okay.
And the other thing that helps is come and see us, and we can again do those custom inserts for them, so that can help relieve some of the pressure.
Perfect. Thank you. All right, live call. Thanks for calling Doc Talk. Go ahead with your question. Sure. Great, thank you.
Yeah, this is Dr. Bhakta again. Our office number is 817-557-1006, and the website is www.accentpodiatry.com. You will get further information on that as well. I do recommend start taking some vitamin B12 complex supplements, at least to help alleviate some of your nerve issues. It's a start. Obviously, it takes a little while to get better, but we want to find out what may be causing your symptoms. Without that, we can't really tell you or even recommend you what to start with, but at least for home remedy, you can start doing that. I do encourage, I'm not sure about your history, but if you do have diabetes, it starts with you controlling diabetes and or your general health, and then we'll go from there.
All right, another call. Thanks for calling Doc Talk. Go ahead with your question. Hello, go ahead with your question. Okay, sir, today we're actually talking about foot and ankle pain, but you can send your question through our website. All right, another call. Hi, it's Doc Talk. Go ahead with your question. Oh, we lost you there, but Dr. Bhakta?
Sure, yeah. This is one of those conditions where it's so vague, swelling and stuff. It could possibly be circulation related, and if they've done the testing, I do recommend at least doing what we call an arterial Doppler to get your circulation checked. And also, while you're there, probably get venous Doppler done to rule out if there's a possible blood clot or venous return or blood going back to your heart to at least get it flow. So get that checked out. But if it continues and it may be related to a structural issue, possible ankle or your bone, cartilage, or ligaments, then foot and ankle specialist would be better. But regardless, you need to have a lower extremity specialist on your side with this type of condition, because the cardiologist may not be able to help you structural issues, and even if you need a circulation problem, you probably need a vascular specialist.
All right, let's keep taking those calls. Thanks for calling Doc Talk. Go ahead with your question. Thank you.
That's a great question. So, diabetics, with any diabetic, I recommend that you definitely either come see us or any other local podiatrist, but you should be under care of a podiatrist, because your heel pain could be secondary to neuropathy, it could be secondary to plantar fasciitis, it could be a lot of different things. And then you having diabetes alone puts you high risk for getting wounds, getting more susceptible to burns. So a podiatrist would usually monitor you every couple months, and then if you did just have heel spurs, which is what we were talking about before with plantar fasciitis, we can treat it accordingly. One of the things we can't really do for you is steroids like we would do for a non-diabetic patients, because this would raise up your blood sugar. So we want to monitor and give you the right treatment, and that's why we don't want you to start treating yourselves.
Can I add to something? This is Dr. Bhakta again. A lot of times people do ask about diabetes and cortisone and steroid injections, and it does put you at higher risk when you put steroids in anybody who's diabetic. But there are other natural remedies. I don't know if some of you guys have heard of Trumeal or Azil. These are some of these products that do not affect diabetes and or increases your sugar. So that's something I would recommend for somebody who is being treated and who needs possible injectable treatment for heel spur or plantar fasciitis.
So those are injectable treatments?
Yes.
Okay.
And something else is PRP injections as well, which is obviously like for those chronic patients that we were talking about. Those are your stem cells, so it's your own blood spun down, and then we inject that. So.
Okay, very good. All right, let's take another call. Thanks for calling Doc Talk. Go ahead with your question. Sure. Thank you.
Yeah, this is Dr. Bhakta again. It sounds like to me you may have some laxicity of your ankle ligaments. This popping sound, it sounds to me like you may have just loose ligaments and or just laxicity. If the problem continues, I do recommend wearing some sort of ankle stabilization, one of those ACE wrap braces. Wear good supportive high top shoes and good supports so you don't get inversion type injuries. But if the problem continues, it does help to see one of the foot and ankle specialists.
All right, let's take another call. Thanks for calling Doc Talk. Go ahead with your question. Sure, thank you.
So you can rest and immobilize her for about 3 weeks to 4 weeks. Sometimes there's stress fracture and that might not have been picked up by the initial x-rays. I recommend getting an MRI if she's still not going to get better, because it's been 6 months and obviously it's not normal for her to still continue having pain if it was just a contusion.
Thank you, guys. We actually had a question during the break from Midhu. She said she had right arch pain in the foot for a long time. On the left side, was treated with steroids, went away. Now she's having it on the right side. So foot arch pain. Is the steroid the only option for treatment-wise, or what is causing that?
So arch pain, again, could be plantar fasciitis, like I was mentioning before. Plantar fascia is a thick band of ligament that goes from your heel to your toes, and that's what's responsible for supporting the arch. Steroid treatment is obviously one of the things we do, but aside from that, like we were talking, there is 2-meal zeal, PRP injection, inserts, stretching, night splints, a lot of other things we do, and usually it starts on one side of as a heel pain and then catches up to the other side. So that's very normal. We see in our practice that the patient comes in for one side and starts having heel pain on the other.
Wow, thank you. Dr. Bhakta, did you want to add anything?
No, listen, if the injection helped first time around on the other foot, I would recommend the same thing.
Same thing on the other foot.
I agree. Wow, guys, this has been an incredible show. I'm sorry we could not get to all of your questions. These are really excellent questions. And in fact, this is for this season, at least, the last show. And I just want to take this time to thank our hosts, all the hosts that came on season 3 of Doc Talk Live, and all you out there, the DFW area. This is really for you guys, and we really appreciate your questions. If we didn't get to any questions, please remember to log on to our website, doctalklive.com, and we will be back with you guys this new year. So please be safe for the holidays. I want to thank you, our guests, Dr. Bhakta and Dr. Mehta, for being here today on the show, and just wish everybody happy holidays. Stay healthy, DFW.